if you guys have any questions, like just feel free to kind of interrupt as we go. You don't have to wait to the end or anything. I'm just going to kind of jump right into it. This is something, teaching moms about postpartum and pelvic floor health is something that's really kind of been on my mind since I first became a mom 11 years ago. I just saw in my own health that this is something that just wasn't getting addressed properly. And it was last year where Dr. Ali Kane, she's a chiropractor up north, she actually held the seminar, was teaching physiotherapists and chiropractors and other different health professionals, kind of banding us together. So we're all kind of had the same message. We're all kind of helping women. So for instance, if there's people in Markham that, you know, decide they want to get checked or get help, that we have, you know, appropriate, like someone to send you to. So a little bit on that. Okay, so just kind of getting into it. Postpartum looks different for everyone for many different factors. How your pregnancy went, different interventions during your labor and delivery, and 3 days postpartum is going to look a lot different and feel much different than if you're 10 or 20 years postpartum. A woman's core is really challenged during pregnancy. I have a little can to kind of help demonstrate what your core is, just so we can kind of get on the same page as far as the definition. Most people think core and they think abs, just kind of being in the midline, but core is a little bit more than that. You have to think of core as your diaphragm. So it separates your abdomen and from your heart and lungs. So your thoracic diaphragm is going to be on the top. Your rectus abdominis and your obliques are going to kind of be on the front. Your sides are going to be something called your transverse abdominis or TVA, and this is going to be very, very important. And then the back would be your back muscles and your butt, okay? Have any of you heard of a diastasis recti, like where the abs separate? Just a quick show of hands, have you guys heard of that? Perfect. Okay, so that's going to be when the abs in the front actually separate. And it's actually when they're going to be separated 2.7 centimeters or more. And almost all women experience this during pregnancy. It's completely normal. What's not normal is that it stays that way. So thinking back to postpartum, that 6-week checkup appointment, most women are asked, you know, sometimes, I guess, how are you feeling? How's your mood? Do you have any pain? And the other question people ask is, are you still bleeding? And that's really about it. And as long as you're not bleeding or having any pain, you basically get a clean bill of health and you're told you can just go back to normal, like ease back into it, whatever that means. And maybe do some Kegels too to strengthen things. And they're not really given, I know I wasn't given any more direction than that. Things are changing a little bit. The conversations are changing. Pelvic floor physiotherapy is something you hear more and more about, which is great. My daughter, Nina, is 9 months old, and my midwife's actually got a handout this time, at least, giving me some kind of direction on what to do, which is way better than it was, you know, 10, 11 years ago. So it's changing. Going back to the diastasis recti though, so you have a new mom, a new kid, she has a different body, she wants to get maybe her old body back or some semblance of herself, what's normal. And she starts doing crunches and kind of these things that are going to be really advanced and actually could be hurting her a lot more than they are helping her. Just a quick show of hands, I want to see this again. How many women were actually checked at their if they remember, at their 6-week checkup to see if they had a diastasis? Was any? Patty was? Jordan? No? Yes. Okay. Yes. So it's good that people are actually starting to get checked because, again, I know I wasn't, and I would say that my healthcare was really, really good during my pregnancy. So I was actually, every woman needs to be getting checked. Not only that, but it needs to be monitored. So if, let's say, if you found out that you had one, how deep was it? How long is it? And then you want to be making sure that you're making progress in that right direction as the months go on, because it does take months to really fully heal. Who's monitoring you, right? And making sure that you're doing the right things. Did anybody have their diaphragms checked? I see no's. Okay. Again, I know I didn't. And then what about their breathing, like knowing how to breathe properly? Nobody. When you think of the baby is so space occupying in your stomach that your lungs actually can't fully inflate. And so your diaphragm, everything is kind of disordered. Yeah, see, no, diaphragms weren't checked. And so in seeing this kind of proper, the breathing patterns return is really, really crucial. If these things go undiagnosed, they can lead to pain in your lower back, in your pelvis, in your glutes. It can lead to chronically sore and tight hip flexors, SI joint dysfunction, so kind of more lower back stuff. Over time, if it's not addressed, weakness, urinary incontinence, constipation. Your more severe cases are going to be hernias and disc herniations, and kind of your more severe things are going to be things like prolapse of organs, where actually your organs can come out. So now we're going to move on to dubs, because that's kind of, as CrossFitters, I know me, it was kind of right on my radar right after postpartum. It's like, oh my God, I have to go back to this, right? And really kind of what's happening when there is leakage of urine when you're doing dubs. So going back to our can here, I think I forgot to talk about the bottom. So the bottom would be your pelvic floor. Think of your pelvic floor as a diaphragm, okay? So it's supposed to support the pelvic contents. It's going to resist any intra-abdominal pressure, so any kind of pressure that you build up in this core or can, and making sure that you can hold your pee and fecal tone. So it will actively contract when you cough or sneeze, vomit, when you lift things, when you skip or you jump. And losing control during any of these is not normal, and you don't have to live with it. It's kind of, I know with social media, it's joked about a lot, like I know in some of the mommy groups, and it's not funny, especially if you're in public, you're in CrossFit. It becomes a real issue. If you are having leakage during dubs, most likely your pelvic floor is underactive. It gets stretched from pregnancy, and it definitely needs time to heal. If you're one of those women who had episiotomies, either tears or assisted vaginal deliveries with either forceps or vacuum, those are definitely some pretty big complicating factors, and you're going to need a little bit more patience and potentially the involvement of another health professional like a pelvic floor physiotherapist to guide you through that process and make sure that any scar tissue isn't impeding any progress. If you're not newly postpartum, you can be healed, but something could still be off for the core. And before I mentioned breathing, what should happen when I'm going to break out my can again. I feel like it's such a good visual. When we're breathing, when we take a breath, our thoracic and our pelvic diaphragms should actually move together, okay? So when we take a nice deep breath in, our diaphragm should relax and they should move down as our lungs fill with air. As we exhale, our diaphragms are brought up again, and our TVA, so the sides of the can, they're going to engage and kind of squeeze in, okay? If a woman can't do that while lying there, doing any kind of activity, heavy lifting or jumping specifically on a stretched or weakened pelvic floor can cause some issues. And this is where specific and targeted training can really make a world of a difference. I've worked with a few clients. I had a woman who was about 40 years postpartum. She literally has had back pain since the day she gave birth, started having back pain immediately. I'm guessing there were definitely some issues with how she gave birth. When I checked her, she had a diastasis that was there. It was probably about 3-4 finger breaths, but she had actually no contractions. She could do this to her abs, but nothing else. There was no action, the squeezing action from the TVA that was happening. So if that can't happen, she can't stabilize her lower back when she was doing anything. So literally brushing her teeth would throw at her back. All these kind of little issues that if this was addressed such a long time ago, she wouldn't kind of be where she was. I've had another CrossFitter come in and see me who could hold planks and do abs for days, but was having some other issues. When I actually helped her learn how to breathe properly, she was actually sore for the first time in her abdominals. That's pretty crazy. To think about. I know I experienced it as well. I could jerk, before I had my daughter, I could jerk more than my body weight above my head with no issue, but I actually couldn't get my TVA to actually squeeze in. I had to lay down and let gravity kind of help that process happen. I couldn't even do it in a seated position, which is crazy when you think about, again, as a CrossFitter, as a mom, as we're picking up kids and doing all these things, that we're not activating those things in the proper order. So how you fix it is really mastering deep breathing and really core pressure regulation. How you don't fix it is just doing Kegels. And that's usually what we're taught. I'm going to be, hopefully once this is all over, be running a course out of Woodbridge. It's going to be a GrowCo course, so through Dr. Ellie Kane, who taught me all of this. And really, the foundation of this program is correcting breathing patterns at its most simplest form. We're going to be doing some other stuff, which I'll talk about in a second. But it's really just going to be a lot of practice with the breathing. The key to this is, again, activating that transverse abdominis and coordinating the contraction. While your two diaphragms, so your pelvic floor diaphragm and your thoracic diaphragm, are working together during that breath. And it's hard. I will tell you the concentration it takes if it is disordered, when you actually learn how to do it properly, is really difficult. Coming back even to CrossFit after a NINA and trying to incorporate that when I'm squatting and doing a lot of those exercises, it makes a difference. But the whole goal of this isn't to come back and just kind of do everything really fast. It's to come back stronger than you were before. Also in the class, something else that we'll do and how you fix this is using that same breath work and doing some simple but challenging core exercises to kind of build on that foundation. Postural work and glute strengthening are going to be super, super, super important. Some of that might be a little simple for the CrossFitters, but it's still really, really important to kind of go back to basics. So anybody have any questions so far? Anything? Has anyone ever been assessed by a pelvic floor physiotherapist? Let's see if I can't see everybody on this view. Yeah, I have. Yeah,
I have too, just once.
Great. And how'd you find the experience? Like, were they helpful? Like, was it more for diastasis?
I just went once, so it was a little weird, so I didn't know what to expect. But I definitely want to continue because it's getting worse. Like even the home exercise, a lot of jumping, it's just so hard for me to continue the 1 hour that's, exercise we going.
Yeah. So you're talking more like jumping and having like incontinence.
Yeah, jumping, jumping, skipping rope, those kind of stuff.
Mm-hmm. If you're having those kind of issues, like while you're jumping, I would suggest maybe subbing something in, some kind of like putting something in front of you and doing toe taps, or just like, instead of trying to do bigger jumps, try some smaller jumps or some other kind of like step ups. So you're still exercising, you're still getting the cardio in, but as you are doing the home exercises, really kind of letting your body heal and working on that.
Yeah. But definitely I want to come and see you once everything's done.
The assessment is important, like, again, just to kind of follow.
You just keep ignoring the problem. Oh, it's okay. But more you get older, I'm turning 50 this year. So more you get older, you see it's getting worse, and it's something you shouldn't ignore.
So as women get older, So me personally, I'll just kind of talk about myself. My experiences, I never had any issues coughing, sneezing, laughing, anything. It wasn't until double unders kind of came and I was like, oh.
Yeah, double under, forget it.
Yeah. But it wasn't even all the time. It was kind of like if it was in a WOD or like at the end when I was already tired and fatigued. So that's where I had like the biggest issue. So again, training the breath, like when you're out of breath, you're panting, you're not taking a deep breath. So kind of slowing things down and relearning that, right, is crucial. But again, so getting assessed, whether it be, with me, or if you guys, live other places that aren't convenient, I can definitely find you someone who can get you guys assessed and point you in the right direction as far as what to do, because it is super important. As far as pelvic floor physiotherapists, ladies, if you haven't seen one and you want to see one, the physio pros at Jane and Rutherford are amazing. All the ladies there are fantastic. I know a couple of my patients have been to them and have had really great experiences. And even going back to doing the GrowCo course, the glute straightening, even just getting a trainer here, you know, at the gyms to work on postural stuff and glute strengthening. I mean, if you're not having a lot of issues or more preventative, is definitely not a bad idea either. Kind of more like focal stuff. Okay. Any other questions? No. So takeaways: postpartum doesn't end at 6 weeks or even a year after you've had a baby. So if you are 15 years postpartum or 5 or a year, it's really important to get assessed. I also want to make a note, men who have big bellies can have this issue as well, have the diastasis and have some issues with some back because of it. So whether it be grandfathers or fathers out there with the big bellies, we've seen this in practice too. Okay. Would I consider doing virtual classes, especially now? Absolutely. If people are interested in that, we can definitely do that. Yeah, absolutely. Anybody else? No? Okay, that's all I have for you. Is there anything that any general stretches? Are there any general stretches or activities that could be helpful for dealing with incontinence? So general stretches or activities. Yes, so this is going back to learning how to take a deep breath. Having someone guide you through it is typically the best way. And if you guys want to sit here or lay down and try to do it right now, I can kind of talk you through it. I just can't be there feeling you hands-on to see if you're doing it right, but you're more than welcome to kind of put your hands on your belly to see if you feel what I'm feeling, or like feel what I would feel. So everyone want to try that? Yes? All right, so if everyone, as long as you can hear me, why don't you guys lay down? If you can find a spot. You can do it seated. I just find it easier the first time to be laying down. Okay, and then you're gonna bend your knees just to keep everything nice and relaxed. Great, and then I want you to put your hands on your waist, kind of right on the ribs, and thumbs kind of right below the ribs, because your thumbs will be facing down. So this type of thing. Okay, so while you're laying there, I want you to take a deep breath. And when you take that deep breath, I want you to start filling your chest, but I want you to feel your rib expand, and I want you to actually see that your belly goes up. So try that a couple times, nice and slow. I can see one belly and it looks good. Okay. Now what I want you to do with the breaths, we're going to add to that. So as long as you're filling your belly with a little bit of breath, you're on the right track. The second part to this now is I want you to visualize that top and bottom of the can. So your two diaphragms. So think when you're taking that breath that you're relaxing. You're relaxing both diaphragms at the same time. So as you're breathing out, as you're breathing in, everything's going to relax. So you're going to take that breath in. So relax everything in your pelvic floor, everything in your diaphragm up top. And then as you exhale, you're going to picture that kind of coming back up, actively trying to pull that back up. And again. And then blow out, and then pulling everything back up. Okay. Was there you guys can come back up for a second. Did anybody not feel the contraction on the sides? Did everyone give me a thumbs up if you felt it? Yes, yes, yes. Good. Really good. That's, again, I found that to be the hardest thing. They could feel like the ribs go out, but when actually taking that breath, as you were exhaling, breathing everything back up, that nothing was squeezing. So maybe let's go through that one more time and we'll add that into the breath. Okay, so lay down for me one more time. Knees bent. Good, and hands on your ribs. Perfect. Okay, so I want everyone to take a nice big deep breath again. So filling that belly with breath. Relaxing the pelvic floor at the same time. And as you exhale this time, you're going to be pulling your pelvic floor up, and think of like a corset squeezing in. So that's going to be your transverse abdominis. And try it again. So relax pelvic floor as you take your breath in. And then breathe out. Again, activating transverse abdominis in. So this isn't a pull your belly button type of, you guys can keep going and kind of practicing that while I'm talking. This isn't a pull your belly button in type of, as you're exhaling. That's like a pretty wrong thing to do actually. As women, I think this is probably part of the reason why we have a lot of disordered breathing, to be quite honest, because it kind of messes up that whole system. So again, not a belly button in so much as like, think of like a corset squeezing the whole way in, like around your waist, like 3D. So try it for me one more time. Nice big deep breath in, relaxing pelvic floor, filling the belly with breath, and then exhaling, bringing pelvic floor up, transverse abdominis squeezing in. And kind of once that becomes normal, so like if you can do 10 of those without even thinking of it, and it becomes like really easy, you can actually, that would then be an appropriate time to do a Kegel at the end of the exhale, and do a Kegel and a squeeze at the end. A Kegel just squeezing from the inside is really only half of the exercise. That transverse abdominis, that corset movement going in on the exhale with the Kegel is really what makes the Kegel effective. Okay. Did everyone find that helpful? Thumbs up if you did. Everybody can do this. Like, just practice your breathing, even if it's 10, 20 breaths, honest to God, every night. You will probably be sore if you're doing it right. And it really will, even just that little thing can make a huge difference. Think of that when you're doing the gym, when you're working out, slow it down just a little bit, and just be cognizant of it. But that's really, it's going to be the basis for the workshop that I want to do, and then adding in other exercises on top of that. Okay. And can I have info? Yeah. Okay. So what I'll do, Steve.
Yeah.
Is there any way to kind of distribute info who's interested?
Yeah. We can put something together that goes in our daily email. And I can have like a Google form for people to fill out if they're interested, and then we can create like a separate email campaign for everybody who does want some more information.
Yeah, sounds good.
Yeah, we can do that for sure.
Okay.
We'll talk more about that afterward for sure.
Yeah, great. Okay, that's all I got. Oh, hang on, I think somebody else has a question.
Thank you.
Oh, you're welcome.
Thanks very much, Becky. Thank you.
It's so good to see some of you. I don't know all of you, but it's so good to see your faces.
Nice meeting you too.
Nice to meet you.
I'm from Markham. Bye-bye.
Bye.
Bye, Becky.
Thanks a lot, Becky. Thanks for doing this.
Anytime.
Appreciate it.
Thanks for having me.
All right, guys. See you guys tomorrow.